Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Clay Gerhardstein, who is a pulmonologist with Baptist, and you've been there a long time also.
I have been there a long time.
Now, we mentioned asthma, and that's one of your specialties, but what is asthma? When you hear that term, what does it mean?
Asthma is also called reactive airways disease, and it's where the airways become swollen and tight. They constrict, and then you hear a whistling sound or a wheeze when you blow out or exhale.
Now, you said wheeze, and I mentioned wheeze when we started, but what are some other symptoms of asthma?
You're short of breath, you can't walk where you want to go. Sometimes people get a dry cough, and that's their wheeze. Now,
what is something that, are you born with asthma? Are there triggers of asthma?
Most people have triggers, and it can be outdoor pollen, cigarette smoke, cold air, exercise.
Can stress trigger asthma?
Stress can trigger it. And if you get a viral infection.
So any type of infection can cause pulmonary problems.
Yes. Yeah.
Tell me about how you make a diagnosis.
We do a test called a spirometry, where the patient does a forced exhalation or blowing into a machine that measures their flow. And the other thing is, it's just a clinical diagnosis. When they come to you and they say they're short of breath, and you talk to them, what makes them short of breath, and are they waking up at night with the symptoms? And that's a clue that it might be asthma.
Are there different levels of asthma? You mentioned waking up at night. Are some asthma worse than others, or is all wheezing not always asthma?
All wheezing is not always asthma, but with asthmatics, something will bother them during the day that will make them wheeze, and then 8 hours later they'll get something called a late response, and that's often at night, and that's why they wake up at night. Okay. It's not something in their bedroom necessarily.
So why worry about asthma? What's the risk?
Well, untreated, it can become severe and even life-threatening.
Especially are kids more prone to have a problem than adults, or is it across the board?
I don't do pediatrics, but I think it's across the board.
Okay, so how do you treat it?
So treatment depends on the severity. You asked me about that. If you have intermittent symptoms a couple times a month, you can just take a rescue inhaler, which is beta-2 agonist that will dilate your airway and give you symptom relief. If you're having weekly symptoms, you need to be on something called a maintenance inhaler. And that is a steroid inhaler. It's topical. People worry about taking steroids, but if you're using it topically, it just decreases the inflammation in the airway and helps prevent the wheezing. And you don't get the side effects you get from taking oral steroids.
Now, if you watch TV or you watch the news, about 15 minutes into the news, they're doing an asthma commercial about different new medications.
Yes.
What are some of those new medicines?
Oh, goodness. When you have severe asthma and you've had to go to the emergency room and you can't come off of steroids, we have a class of medications called the biologics. And they attack different types of inflammation. So it would be Xolair or Nucala, Dupixent, Fasenra.
All those that show up on the news after
all those
50
show
minutes.
up on the news with the funny names. They're usually injections, and you can be taught to give yourself the shots. We also have a PharmD in our office that'll give them to you as well.
Okay, so you talk about inhaler injection. intermittent treatment, whatever the treatment, it is important to stick with it and do it so you don't have a flare?
It is. People feel better and then they stop and then they get symptoms again and they'll yo-yo with, if they stay on their maintenance inhaler, it will control their symptoms. And it's fun to treat because they come in pretty miserable where the asthma is affecting their life. They can't participate in sports, or they're not sleeping well, and then you get them under control and they're like, oh, they feel like they have their life back.
Well, and one thing too we talked a little bit about is avoiding a trigger. The big thing we always talk about is don't smoke cigarettes, because that does it. But if you know you're allergic to cats, avoid it.
Correct. You really do have to look at your environment. Scented candles, certain household cleaners can trigger it as well, and animal dander. And people do get allergy tested, and you can't avoid life. You can't avoid grass and tree pollens, but you can avoid animal dander and
Well, we appreciate all you do, appreciate the care you give the patients, and thanks for coming in and talking to us.
Thank you, Joe.
All right. We'll be right back.